I think at the foundation, especially now that I'm a parent, I really go back to that bread and butter family-based dentistry. That's the core of who we are now. We do the full spectrum of dentistry, from travelers to seasonal residents to second homeowners, but there are lots of families raising young children here, and so I feel like that's something that we're really good at. We talk about happy visits, getting a child in here for a low pressure visit. They don't necessarily need an exam, they don't necessarily need their teeth cleaned. If they are comfortable with that, so be it, but it's about kind of pushing their comfort zone just a little bit and getting them comfortable with the sights and sounds that can be a little intimidating. I mean, it's not normal to lean back in a chair and have a bright, shiny light shine in your eyes. But if parents are on board, my team is fantastic, putting cartoons on the TV above them. I call it SpongeBob sedation, because if you can get them a TV show that they like, they can be almost completely comfortable with anything that I do. So I think that's really getting them on board and feeling them comfortable with their dentist. I feel like when I talk to patients, they either love their childhood dentist or they may have had a bad experience. And in my mind, I want to, when this 4-year-old is 24 years old, I want them to be thinking about, I had such a great experience as a child with Dr. Maloley's office at Vail Valley Dental Care. So to me, it's all part of the life cycle process. We've only been here for 5 years, but to see kids literally from 2 to 7 and now losing teeth is amazingly gratifying. Our families who had no kids now bring, it was husband and wife, and now it's husband, wife, and 4 kids. It's who I am as a person, I think, as a family man first, and to see families come in, or sometimes it's the child will come first and they'll test the waters and the child will have a good experience, and then mom will come, and then the man who doesn't want to see any doctor of any type will finally get convinced that this is a good place to be. A lot of time that all starts with a good childhood experience. So, like I said, the mental health is more important than the dental health, because the dental health, we can do lots of things along the way to kind of help things along, and sometimes it means just letting a tooth fall out or what have you. But the mental health, if that gets, I'll say, corrupted at a young age, it's difficult for someone to become someone excited about their regular visits in dentistry. So I'm always thinking about the psychology side of things, because I think it's a point that too often gets ignored in dentistry. And if you plant those seeds as a child, just as I do as a parent with all the other things, those habits, and getting them excited about coming here, seeing the cartoons on the TV, digging in the treasure chest when they're done, knowing that they can leave with gloves and masks if they want to be a dentist when they grow up. All those sorts of things we try and add into the experience, so that everyone, there's, you can make a child happy, but if you don't make mom happy, then you haven't really served the family. And so all those things I think we're kind of thinking about during the process, because that starts at the first phone call and goes until the child leaves. And then the most important thing is that they come back for regular visits to make sure that we're getting them healthy and maintaining the health for them.